Cannabis, also known as marijuana or weed, is one of the most used psychoactive drugs worldwide, and especially among teenagers. In fact, 1/3 of teenagers report using cannabis at least once before the age of 15. But if cannabis is legal in Canada, can it really be all that bad for you? What happens when you use cannabis, and how does it change your brain? To answer these questions, we first need to understand what cannabis really is. Cannabis is a drug that comes from the cannabis sativa plant. The drug can be made into many different forms such as oils, edibles, and dried leaves for smoking. Cannabis is made up of many different ingredients known as cannabinoids. These cannabinoids include delta-9 tetrahydrocannabinol and cannabidiol, or what we call THC and CBD. THC and CBD are the two main ingredients responsible for the high associated with cannabis use. The short-term effects of cannabis use include several symptoms such as a sense of euphoria, well-being, relaxation, and as well as a heightened sense of hearing, taste, smell, and sight. However, negative symptoms can occur as well, depending on how the body reacts to cannabis. According to the Government of Canada, negative thoughts such as feeling unwanted or unpleasant are often described to be correlated with using cannabis. This also might be accompanied with psychotic episodes of hallucinations, delusions, and paranoia. And for people with cardiovascular problems, cannabis can induce acute effects such as increased heart rate and decreased blood pressure, causing dizziness and fainting. Over a prolonged period of use, the effects of cannabis can snowball into chronic symptoms that could last weeks, months, or years, depending on the frequency and intensity of dosage. Long-term cannabis use can lead to a multitude of problems that can affect your daily life. People who take cannabis at a high, frequent dose often experience decreased memory function, concentration, intelligence, and the ability to think or make decisions. Effects can even be more amplified if heavy usage started early on in adolescence. Cannabis use disorder, or CUD, is a term used for those that continue to use cannabis despite psychological, physical, and social impairments. Cannabis interacts with our brain through something called the endocannabinoid system in our body, and this endocannabinoid system consists of endocannabinoids and cannabinoid receptors. These endocannabinoids are our body's natural versions of the ingredients we find in cannabis, and they bind to cannabinoid receptors distributed throughout the body. Think of it as a lock and key system where the endocannabinoid is the key and the cannabinoid receptor is the lock. When the endocannabinoids bind to these cannabinoid receptors, the receptors turn on and create a bunch of different effects in our body, and this helps us with our daily function. Specifically, cannabinoid type 1 receptors, also known as CB1 receptors, are found throughout our brain in areas responsible for thinking and feelings of reward. However, our body's natural endocannabinoids and the cannabinoids found in cannabis are very similar. They are so similar that the CB1 receptors can't really tell the difference between them and allow the ones from the drug to bind as well. The activation of our CB1 receptors by these outside cannabinoids gets in the way of the system's normal function. So, what does this have to do with addiction? Well, our brains have something that we call the reward circuit. When this reward circuit is excited, we become motivated to pursue anything that causes us to feel good. Usually, we have a balance of positive and negative stimulation to this reward circuit so that we can control our behavior. But when cannabis binds to CB1 receptors, it causes an increase in the positive stimulation and a decrease in the negative stimulation. The overall increase in excitement causes us to be motivated to continue using the drug because it feels good. As part of the reward circuit, we also have approach and avoidance pathways. Think of the approach pathway as a go signal and the avoidance pathway as a stop signal. When the go signal is activated, we are motivated to pursue feel-good things. When the stop signal is activated, we know to stay away from harmful things. Cannabis actually causes the go signal to be stronger and the stop signal to be weaker. This can help us explain cannabis addiction. Cannabis causes us to become motivated to pursue the feel-good drugs while canceling out the instinct to avoid something that could cause us harm. Without this balance, we fall victim to dangerous drug-seeking behaviors. Although the negative effects of cannabis are experienced by regular cannabis users, recent studies have shown that these effects are actually worse for teenage users. In fact, studies that followed teenager cannabis users into adulthood reported that these individuals had worse attention, verbal memory, and lower IQ scores than their peers. Researchers believe that this is because our natural endocannabinoid system is taken over when THC is consumed. This then affects the role of the endocannabinoid system to fine-tune our brains during our teenage years, leading to troubles thinking clearly. With the legalization of cannabis in Canada, more and more youths are being exposed to the substance at a higher rate. While we should not demonize this drug and its effects, the focus should be put on expanding the public's knowledge about cannabis as well as providing support for those in need. Although there are proposed benefits of cannabis use, such as sleep aid or helping with inflammation, there are still concerns for teenager cannabis use. The direct effect of the drug has a powerful impact on the structure and function of the malleable teenager brain, causing detrimental results in adulthood. To better help the community, St. Joseph's Addiction Services offers informative programs to educate the public and also provides rehabilitation services. For people ages 17 to 25 in particular, St. Joseph's Youth Wellness Center offers an accessible environment for people looking for care regarding substance use and mental health. All of these services are covered by OHIP and are purely confidential between you and your healthcare professional. 3 streams of services are offered depending on your needs. The first stream is early intervention, where youths with emerging mental health and addiction concerns can seek expert care such as assessment, counseling, and therapy. This program is aimed to identify, assess, and treat mental illnesses as soon as possible. The second stream is transition support. It is directed towards youths who are already undergoing specialized mental health services from community partners and want to avoid a disruption of support when the youths reach 18. The third service, the mobile team, is offered to youths pursuing post-secondary education or those experiencing difficulties in accessing mental health and addiction services. If you would like to get more information about the programs, you can contact St. Joseph's Youth Addiction Services at 905-522-1155 at extension 31725 or by looking up the Youth Wellness Center at stjoes.ca.